Good morning, everybody, and welcome to the e-Pathshala. Today, we are going to discuss healthcare delivery system under social medicine and community health. And the module of the paper which we are going to discuss today is healthcare and delivery system in India, that is at the state level. If we want to know the routing of any program, we have to know the ladder through which we have to cross in order to go up or in order to reach down. And just before we go that, one word of appreciation for the development team, the principal investigator being Professor C.P. Mishra, and along with his colleagues from Aligarh Muslim University. Thank you. Learning objectives. Learning objectives are actually the baseline of any program, because it is but natural that if we want to start a program, whether it is a national health program or any other program, we must know what do we want to achieve by. In other words, we should know what are we going to learn from such a program if we set it into motion. So in this case, it is healthcare organization. What we are going to learn is healthcare organization at the state level, healthcare setup at the state level, duties and responsibilities of Joint Director, Health Systems Administration. In other words, we have to know what we are working at, who is going to be doing it, and what are the important points which have to be delivered. Introduction. Healthcare delivery in India has been envisaged at three levels, namely the primary, secondary, and the tertiary. At the state level, the healthcare delivery system is under the State's Department of Health and Family Welfare, headed by a minister and with a secretariat under the charge of the Secretary Commissioner, that is Health and Family Welfare. The State Directorate of Health Services, as the technical wing, is an attached office of the State Department of Health and Family Welfare and is headed by a Director of Health Services. So what we are going to deal is the beginning of the state health services. To continue, in the introduction, the area of medical education, which is with the Directorate of Health Services at the state, is known as the Directorate of Medical Education and Research. Now, these are terminologies which all students have to become familiar to a certain extent, and you need not remember them, but you must know the direction in which the health services flow, because this is how orders are passed, this is how changes are made, and this is how mid-course corrections are made. This directorate is under the charge of a Director of Medical Education, who is answerable directly to the Health Secretary or to the Commissioner of the state. Some states have created the post of Director, that is Ayurveda, and Director of Homeopathy. If you remember, in the last lectures, we have been talking about the third wing of the medical services, and that is Ayush. Ayush meaning the indigenous or the indigenous systems of medicine, which includes Ayurveda, homeopathy, Unani, Siddha, and homeopathy. So we have to have some officers looking after these programs also. Now, introduction. These officers actually enjoy a large autonomy, although sometimes they still fall under the Director of Health Services of the state. And health, as per Constitution of India, we must remember, is a state subject. So it is quite possible that state-wise the health services might vary from throughout the country, although basic pattern is there on which the state can build up its health services. Now, the state health department is of course assisted by corporations, municipalities, Panchayati Raj, ad hoc statutory bodies like the Mines Board of Health, the ESI corporations, or wherever they exist. Now, this also we talked in the last lecture, that special services like mines or employee state insurance for labor people, and let us not forget the railways. They have their own set of medical services, delivery services, and they have the centers at which their people are likely to go and get treatment. And of course, if it is a higher center, for example, like higher diseases like cancer or any other diseases which may be difficult. So they have to be referred to the bigger centers or to the higher centers where they exist. Now, administration. Administration is a very important part. Now, the political head of this particular administration is actually a minister of a cabinet rank, and he is the political head of the health department. And in this, the minister of this rank has to be helped by a team of scientific people who are in the subject, and they of course formulate policies, monitoring and implementation of these policies. To help them, actually there are separate boards who make up the programs, who make the national programs. These are brought in front of the cabinet or in front of this political head, and when he gives the go, then this written document becomes a program which is instituted into the country. Now, administrative head. The state secretary, although the cabinet rank minister may be the head, actually the political head, but it is the state secretariat which controls and governs the health activities of the state. Now, what does a secretariat mean? It means a complex of departments. It's not the work of one department, it is the mix matching of a lot of departments who take, so it could be financial, it could be planning, it could be implementation, it could be supplies, it could be control, it could be retesting the program in time to make proper corrections. And this is definitely headed by an IAS officer of the rank of commissioner who functions as a secretary to the government in the Department of Health and Family Welfare. And of course, he is assisted by joint secretaries along with the other administrative staff. Now, we must remember that although the IAS officer is heading this, he is again at the state level. He is helped by his medical department, which along with the joint secretaries help him in this particular work. But the technical head, now who's the technical head? Executive department actually functions below the secretariat, and this is headed by specialists and are concerned with the supervision, coordination and the control of the policy, which is actually framed by the state government. Now, this is headed by the Director of Health Services, who has under him joint directors and deputy directors who are also responsible for inspection and supervision of all the national health programs. Now, we must remember that the national health programs are actually started right from the center, and after which, once they are approved, they are formed into a planning, they are planned, implemented. Before implementation, it is sent to the state, and from the state, which puts its final seal of approval. And this program, although it is a national program, it may vary from place to place or it may vary from state to state. So as such, then the state rules come in, and the state then starts this program by diverting it to the block, to the tehsils, to the primary health centers, and finally to the grassroots level. In the 29 states in India, each state having its own health administration. And in all the states, the management sector actually comprises the state ministry of health and a directorate of health. And in this, each one has its own role to play, and they have to play their roles, and they have to implement the program within a stated time limit, which is very important, because without the time limit, this is what we know as planning and action. Now, for each and every planning stage of the program, it is important that the orders must go in, the workers must be working, and each one gels the whole program in itself, so that everything is completed. Now, if the vaccines have to be ordered, we have to know how much of time it will take for the vaccines to be ordered before they come in time, and how much time will it take for it to be distributed. So it must be distributed at the right time. Before that, the enumeration of the under fives or the targeted population must be done well in time. Now, to continue, then the technical head for the executive department actually functions below the secretariat, and this is again headed by the specialists and are concerned with supervision, coordination and control of the policy which has been framed by the state government and which was originally framed by the central government but modified to suit the needs of the state government. Now, this is headed by the Director of Health Services, who has under him the joint directors and deputy directors responsible for inspection and supervision of all the national programs. And as I've already mentioned, that the State Ministry of Health, it is headed by the Minister of Health and Family Welfare and the Deputy Minister of Health and Family Welfare, who in turn are helped by their full team of secretaries and joint secretaries, and the Health Secretariat is actually the official organ of the State Ministry of Health and is headed by a secretary who is assisted by the deputy secretaries, under secretaries and a large administrative staff. See, it is all right to be naming all the various staff who are employed right from the center to the root level. This lecture is mostly to give an awareness to the students who are going to listen to this, that there is a system, there is a ladder which has to be followed right from the center to the grassroots level. Because without which no program can be shifted, and the program must take precedence in the fact that it must be shifted step by step to whoever is going to manage it to be sent to the lower level. Because our main aim for any program is that we must cover at least as much as possible the targeted population, whether it is in MCH, that is the mothers and the children, or whether it is the under fives, or whether it is the aged population. So whoever is the target population, the enumeration of the target population and the coverage to as much as possible must be done, otherwise we are going to leave loopholes in the program. Leaving loopholes in the program means that the program will be incomplete in areas, and therefore if we are, for example, if we are dealing with an infective disease, that means there will be still pockets and loops of these infective diseases which has got ample time to rapidly spread into a population which obviously we have tried to control. So therefore, it is very important that coverage should be as close to 100% as possible. Now, the secretary who is looking after this entire program is a senior officer of the Indian Administrative Service, but in any case, he has to be helped by the actual medical people. And in this case, the Director of Health Services is the chief technical advisor to the state government. So, if the IAS officer has to do anything, he has to have by his side the Director of Health Services, who is the chief technical advisor to the state government on all matters relating to medicine and public health. Also responsible for organization and direction of all the health activities, which I have been emphasizing in plenty. And with the advent of the family planning as an important program, the designation of the Director of Health Services has now been changed in some states and is known as the Director of Health and Family Welfare. Because whatever said and done, any program, whatever be the program, this program of health and family welfare cannot be left single, nor can we deal with it singly, because family health and family welfare is a part and parcel of the family, and as such, any action you take in the family must be, although it may be directed towards the required targets, must include family welfare. Now, in the State Health Directorate, the Director of Health Services is the Chief Technical Advisor to the state government on all matters relating to the medicine and of public health, and he is also responsible for organization and direction of all the health activities. And with the advent of family planning as an important program, the designation of Director of Health Services, and of course, has been changed to the Director of Health and Family Welfare, as I've already mentioned, because now this Director of Health and Family Welfare, he has to have his own medical and assisting team. And they are assisted, of course, by a suitable number of deputies and assistants, each of one who knows his work to the team. The deputy and the assistant directors of health may be of two types. That is, the regional directors, who inspect all branches of public health within their jurisdiction, irrespective of their specialty. Now, this public health is important because public health will be a part and parcel of the medical services which are being given to the public through the channels of implementation. And the functional directors are usually specialists in a particular branch of public health, such as mother and child health, family planning, nutrition, tuberculosis. Now, one more word in order to emphasize this. Because these two directors, whenever we talk of health is a comprehensive subject which has to be dealt at the community level. At the community level, we have at the grassroots level a family, and a family is a part of the village circumstances. So, as such, we are looking at the entire community. One family problems or one family are definitely going to affect another family. Now, for example, take a case of tuberculosis. Now, this family lives in a village, is surrounded by other families. The head of the family has tuberculosis, and fortunately, unfortunately, he is a AFB positive case. Now, because of lack of health education and knowledge, he is going to be spitting all over if we do not teach him. It is there that the other directors of public health step in order to teach him the ill effects of spitting, of throwing sputum irregularly, so that because within 3 feet, if the sputum dries out, then it is likely to affect any person up to 3 to 5 feet within that area. So, what we call as a dooryard pollution. So, dooryard pollution has to be prevented by those people who are knowledgeable of public health and safety hazards. Now, the functional directors, who are the persons who are going to treat these people, he will be treating the case. The tuberculosis case has to be diagnosed, has to be caught in time, has to be attached to the National Tuberculosis Program. The directors and the doctors have to see to the case, and we have to see that either the case comes to the Center for Medicine, that is either to the primary health center or to the sub-center, or it is possible that he may even go to the district office for a proper tuberculosis and for a proper tuberculosis treatment, which has to be continued without fail. Now, what are the functions of this entire health program? There could be multiple functions which we have to see, and most important functions are integrating health services. This is precisely what I've been talking in the past 2 slides. We have to integrate all health services, whether they are preventive, promotive, or curative. And we have to include it along with the family planning programs. So, therefore, integration of health services is very important. Availability of medical facilities should be there, because if we are going to integrate the health services, we need the medical facilities must reach the grassroots level in order to be useful. Then we have to plan the health programs and drawing policies in providing health regularly. Then provision of medicines has to be there. We find the tuberculosis case, we find the leprosy case, and the medicines do not reach him in time. There is no purpose in treating him, because he is going to be infecting a lot more patients in and around his village circumstances or in and around his community. Therefore, provision of medicines in time at the right centers to be delivered to the right persons within the right limit of time is important. Provision of control of milk and food sampling. Now, this is another thing. Our village folk, our community folk, our folk in the rural areas actually have very little knowledge of keeping food in a sanitized form. In, of course, the cities, you have very fancy fridges and all where you can beat the heat, in fact. But it is those areas, those villages, who do not have these facilities, who do not have the facilities of electricity. So therefore, we have to tell them that if food is cooked, it must be consumed as soon as possible. Number two, in the heat, in the hot weathers, or in the where the food can go bad, we have to take a lot of precaution that the food does not start rotting, and if people are going to eat that, it may result in food poisoning of the family. Promotion of health education. Promotion of health education is important because without explaining the importance of these, we cannot do anything. So, health education at each and every step of service of medical treatment is important. So, promotion of health programs like family planning, school and occupational health, then supervision of the primary health care, establishing training courses for the health personnel, coordination of health services with the other ministers of the state. See, in order to send people into the village, you have to train them. You cannot send them raw because they must transmit the correct amount of knowledge to the person to whom it is meant. So, correct knowledge at the right time through the correct person to the correct audience should be the main important theme. Now, at the regional level, in the state of Bihar, Madhya Pradesh, Uttar Pradesh, Andhra Pradesh, Karnataka, and other zonal or regional or divisional setups have been created between the State Director of Health Services and the district administration. Each regional and zonal setup covers 3 to 5 districts and acts under authority delegated by the state. So, we have to follow rules, and the service must flow in the direction in which it is intended. The status of officers in charge of such regional or zonal organizations differs, but they are known as additional joint deputy directors of health services in the different states. Now, here is a picture of the organizational structure of the health services at the state level. And this, as you can see from what we have been talking, it flows right from the top of the state where the minister is in charge of the health and family planning, and he is the politician, but he has to be assisted by now the authorized and the educated inline people like the secretary or the commissioner or the doctors or the people of public health. And from there comes the technical people, that is the director of health services, director for family planning, director for medical education, and director for ISM, and that is Indian medicine and homeopathy. Then, of course, they will be followed by their juniors, the deputy directors, and in some cases where the director of medical education is coming in, the dean of the medical college is a very important part because some programs have to be channelized through the medical colleges. Then you have the assistant directors of health services, and it goes right from the district to the taluka to the block level, and in this way orders, instructions, supplies all follow the line very comfortably. Now, healthcare set up at the state level. Of course, like we have been talking, we need a minister of health and family welfare, and of course, he is assisted by his deputy. Then you have, under them, you have actually the administrators of the IAS cadre, in which you have actually the principal secretary of health. Then comes a commissioner of health, and they in turn are assisted by actually technical experts. For example, of Gujarat, let us take, there is a director, of course now the post has been abolished, but you have additional directors of health, that is the PHCs and the CHCs, the community health centers, Then you have the additional directors for family welfare, medical education, research. So you have to have separate additional ADHs, additional directors in all these different, because each subject is a vast subject and each entails education, planning, and service to the right to the last detail. And they in turn are helped by at least two joint directors. Now, what are just roughly, what are the duties and responsibilities of additional director of health services? The administration. He has, of course, to see to the general monitoring and the overall in charge of health administration on behalf of the director of health services, monitoring of the central medical store, because from where the drugs have to go in, the chairman recruitment board for directorate staff, so you need staff, so you need to recruit them. There is a no demand certificate for all categories of officers, maintenance of attendance registers of guested officers of directorate, and initiation of proposals for the post of DDHS and above. These are all actually the official channels through which they have to go, and the official works which are co-relevant with the actual medical service which we want to give. And of course, there has to be a disciplinary cell, so there is an in charge for that cell. And most important, the financial authority, the additional director for financial, who will control the function bills, the sanction of the cash equivalent of leave registers, etc. Now, duties and responsibilities of additional director of health services of administration. Actually, we have to continue with this, and it is not only that we have to establish the medical officers. We have to see to the miscellaneous cases of post-mortem. Now, this is very important. In some certain cases, of course, in most of the important towns, you have the post-mortem. But in certain places, certain types of cases have to be sent to the main capital of the state. So, therefore, the miscellaneous cases of post-mortem examinations have to be done, and proper advice to the police has to be given. Then setting up of the medical team on request. Now, if there is an emergency, a medical team in floods, in times of floods or natural disasters, a medical team has to be immediately sent to that place. For example, we had floods of the Ganges, floods of the other rivers, or you have earthquakes, and we had that huge natural disaster in Uttaranchal. So, therefore, in the hilly regions, where you have the slipping of the so medical team as on request has to be sent. Then most important, medical reimbursement. Then the police morgue is there to tackle problems. Because now police morgue, just a small word about this. Police morgue has to be maintained because certain cases don't close. So it is the rule of the police morgue that you cannot close. You have to maintain the body and the remains which have come in with that till the case is closed. Now, to tackle problems of hospitals in West Bengal and conduction of inquiry and sending of reports to the higher centers, and of course, mundane things like leave travel concession to the staff or general inquiries related to the administrative branch. Now, one most important thing is the renal transplant board. See, because renal kidney transplantations are a matter of national importance, and we are having a lot of medico-legal inquiries into these renal transplants. So, these have to be organized, they have to be justified, and they have to be put through the right line so that the right person gets it at the right time, rather than you paying an extra money and getting it out of the line. And of course, the assembly matters. Then you have some responsibilities of the Joint Director of Health Services and Administration, and in which case, of course, the same thing of monitoring of nursing establishment is an important thing. Monitoring of health transport system. Now you have your own vehicles, and these vehicles must be kept in proper order in order to be able to transport the health teams to the field as and when required. medical reimbursement, then there's a nodal officer for health monitoring system, hospital administration, financial authority, most important, general grievance and the public grievance. There must be a cell in order to be able to the grievance from the public, and of course there are court cases, judiciary part of the medical circumstances, and to continue, of course, the usual appointment, transfer, posting of cases of nursing career, as and when required. These people will have to be transferred as per the requirement. You have establishments of assistant superintendent, telephone bills are there, court cases are there, then the store purchase committees, most important, hospital for hospital, the linen keeper, dietitian, library, central court. See, these are all important aspects of running a full program, without which actually a program is left helpless. You just cannot have a single program wherein you only organize the medical part of it. Along with the medical part of it, there is a lot of side issues which have to be seen to. And for example, licensing authority. Now, this is another important factor. I must take some time to talk about it. Today, we are having rules and regulations right from the state authority as well as the central authority for looking after looking after established diagnostic centers, and for the nursing homes which are springing up like mushrooms. So these nursing homes and these diagnostic centers, number one is for sex determination. It cannot be done, it is not permitted and not justified. And secondly, all the nursing homes or the clinics must follow certain rules and regulations. And of course, the diet committee, there is a chairman for that also. And there are the usual administrative uses. And last of all, the Deputy Director, Health Services Administration, because if people are going to work there, they have to be part of the authority. They get salary, so there's a pension cell, pay cell, financial authority, and most important, right to information. And let us not forget the Human Rights Commission. Human Rights Commission is important because every single patient, every single person has got every right to proper knowledge and to proper technical care from the technical persons who are employed under these circumstances for their health. And to summarize at the end, that healthcare delivery system is actually under the State Department of Health and Family Welfare. It is headed by a minister and with a secretariat under the charge of the secretary and commissioner. It consists of a political head, administrative head and technical head, each of who has his defined roles. Each head consists of various employees and their charges that perform their assigned duties and responsibilities to ensure proper functioning of the healthcare delivery system. At the state level, the healthcare delivery system is under the State Department of Health and Family Welfare, headed by a minister with a secretariat in charge. And so, thank you for visiting the Channel.